Acquired immune deficiency syndrome, AIDS, has become the plague of the 1980s. It presents a daunting problem for medical science. Almost as daunting are some of the ethical dilemmas it regularly creates for the people at this table. But they could not talk openly about actual cases for fear of breaching confidences. So they have agreed to answer questions about a hypothetical case. The moderator is Professor Arthur Miller of the Harvard Law School.
Let me tell you about a megastar. His name is Bobby Born-Again. He is bigger than the Beatles ever were. He is an active Christian without being evangelical, so nobody's nose ever gets out of joint when Bobby performs. But over the last year or so, Bobby hasn't been seen much. He hasn't performed. And a lot of people wonder, where is he? Now, Mr. Gale, you get word that Bobby has AIDS. Does that start your journalistic juices flowing?
Certainly it does, yes, straight away. No difficulty there.
Why?
By definition, he's a megastar. He hasn't been seen. There's a mystery about him. And then if on top of it, the explanation of that mystery is that he has this disease, AIDS, then the public interest in this would be absolutely immense.
Would you go visit Barbara, his wife?
I certainly would. I want to try to find out where he was, where his wife was, where his acquaintances were, what his friends knew about it, what his professional colleagues knew about it, what his medical people had to say about it, if one could get at them.
You interested in knowing how he got it?
Of course one would be.
Well, let's say you go to Barbara. You come to their home just after their morning prayers.
Yes.
And she's very tearful. She confirms that Bobby does indeed have AIDS. It's not clear how much longer he'll last. And she says it's really a tragedy. It's a tragedy. Do you know how he got it? We go to this church, and there's somebody at the church who had AIDS. And it's very clear to me that Bobby got AIDS from the communion cup. But what are you going to tell your readers?
Bobby Born-Again has AIDS, and since he has it, one would be entitled, I think, to say he's dying from it, because, as I say, this is a consequence of it, and there's no known cure. And one would also say that in his wife's opinion, he caught it as a consequence of taking communion.
Now, you said that you put some medical opinions side by side. So I assume you'd go confer with a specialist?
One would certainly look to experts, and possibly, preferably more than one.
Well, there's Dr. Pynchon,
Yes.
one of the nation's great specialists
Yes.
on AIDS. Why don't you talk to him?
Well, then, I would ask him, first of all, in your view, would you explain how you think the disease is transmitted?
Without reference to any case, I would answer that there are three routes of transmission of this infection: sexual, blood-to-blood transmission, and from mother to her unborn child. There is no other known route of transmission, despite a very substantial number of people infected in the world.
Well, and then I would then say, well, is it in your view in any way possible that the belief of Barbara that hasn't caught it through taking communion has any scientific foundation?
I would say there's no scientific foundation for it. There are a lot of rumours and misunderstandings, but I would not accept it as an explanation.
I would then ask you, is there any scientific debate among your colleagues as to what you've just said?
Not that I'm aware of.
I would then check that with someone else and print that.
Check it with Dr. Farthing.
There's no evidence that the virus can be transmitted in saliva, and there's a good deal of scientific evidence now that points to the fact that absorbing the virus into the mouth, even in considerable quantity, will not lead to infection in the person who's absorbing it.
What is the incidence of the disease now? It's been here for 3 years. How widespread is it now, and how widespread is it likely to become?
The disease, if you mean the virus, is now very widespread, but not everyone infected with the AIDS virus has yet developed AIDS, and we hope that only a small minority will.
Those who've developed the virus, have they anything in common?
They're by and large homosexual men, intravenous drug abusers, or a few who've received it from blood or blood product transmission.
Are you at all concerned at the public reaction to this story?
One would wish to set at rest the minds of those people in the country to taking communion. One would also, of course...
Well, you could do that by not reporting this crazy notion of Barbara Born Again.
Well, you could, but I mean, one would have reported it, notwithstanding that.
Any reaction, Mr. Whitehead?
I think given the level of public fear about the disease, that the very fact that it was suggested it could have been spread through the communion cup, no matter how carefully that was balanced against medical evidence, would put fears into people's minds about the possibility that this could happen.
Sounds to me as if you wish this column were not written.
I most certainly would wish it weren't written, yes.
Wouldn't be a column, I might say. It would be a front-page news story.
With pictures of people fleeing from the communion.
No, with pictures of Bobby Born Again and his wife. Glamorous ones, preferably, or pictures of him looking like as if he was at death's door, happen to be available.
Before and after.
That's right.
As they do in the adverts.
That's right.
Now, Mr. Gale, do you believe these two doctors?
Yes.
Do you, Mr. Judge?
Not really. I would still be concerned about going to the church for a start, despite what our worthy doctors have told us. I find it quite strange that they are now issuing kits to police and ambulance men to treat AIDS victims if there's no danger to them whatsoever.
So you take your medical advice from the police?
Yes, I think I would at this stage. I don't think sufficient is known about the virus.
Any apprehension?
Yes, of course there is. People are dying.
You enjoy lunch, don't you?
Yes. I wouldn't enjoy it if I thought it was coming from a kitchen staffed by sufferers from AIDS.
The Hungry Gourmet. There's a rumor floating about Fleet Street.
Yes.
That one of the waiters at the Hungry Gourmet has AIDS.
Yes.
Do you give your patronage to the fatted calf across the street now?
Well, I certainly avoid the Hungry Gourmet. What is more, this again would be an interesting story, although not of the same scale as Bobby Born Again. And
we're going to fill your paper this morning.
No, well, there's plenty of space besides.
So you wouldn't go to the Hungry Gourmet?
No. Why should I? Why expose myself to a needless risk, however remote that risk might be?
Even though medical science has told you saliva...
You believe what the doctors have
Unless
said.
you believe the waiter spit in the food.
Hang on, you've already said, one of the witnesses said it can be transmitted through blood. People chop up things in kitchens, and sometimes including their fingers. I might enjoy a very rare steak.
Who do you think they're cooking in the back room?
I don't think they're cooking anything.
Mr. Judge, how do you feel about that?
I'd go along with the rumour. No way would I go to the restaurant.
Medical science has been displaced by the police and rumor. Would you go to the Hungry Gourmet?
Yes, I would eat at the Hungry Gourmet. I think even if the finger was chopped and there was blood in the steak, I think it's extremely unlikely that I would become infected because of the evidence suggested that oral absorption does not result in infection. I have, in fact, eaten meals prepared by AIDS patients, and so I do practice what I preach.
Dr. Pinching, would you go to the Hungry Gourmet?
Yes, if it happened to be the better restaurant.
Dr. Farthing, one of the waiters at the Hungry Gourmet, his name is Samuel Server. He comes to you at your clinic. And he says, Doctor, I've been reading a lot about this AIDS stuff in Mr. Gale's paper. I hear you might be able to get it from a chalice cup and things like that. I think I should be tested for it. What do you think?
I'd explain to him that the test would mean that he had been exposed to the virus if it was positive. And if it was positive, it would mean he probably still had live virus on board, that he could infect others by sexual or blood means, and that there would be a chance he might develop AIDS. If he was a very nervous man... Could you tell me a little bit about your sexual activity? Do you have a steady partner? Are you a straight man or a gay man?
I have had some relations with men.
Yes. Do you sleep with more than one person at the moment?
Yes.
Are you aware, you are aware of the risk of AIDS? Do you have anal intercourse with your sexual partners?
Sometimes.
Do you protect that anal intercourse?
Protect?
With condoms?
Sometimes, but not always.
Do you realize you're leading an extraordinary risk? You may be carrying HTLV3, the AIDS virus, at the moment, in which case if you are having active anal intercourse with your friends, you could be committing manslaughter almost. Now,
are you trying to frighten me?
I am just pointing out the risks that you run. If you're not infected and you're having anal intercourse, active or passive, but particularly passive, you are possibly committing suicide in London at the present time.
What are the statistics in London?
The statistics are that 1 in 3 gay men attending sexually transmitted disease clinics are already infected.
Dr. Green? He's your patient now.
The test in some ways is irrelevant to the advice that I'm going to give him, because I'm going to give him the same advice if he's positive, or if he's negative, or if he chooses not to be tested.
Well, I can't see any reason why I shouldn't take the test, do you?
You wouldn't be able to get an endowment mortgage. You might have difficulty in filling in a health questionnaire for employment. And a lot of people who are tested find that their friends have told another 100 people, or that they've cut them off, they won't answer their telephone calls, or they won't see them for dinner.
Ostracized.
Yes, indeed.
Dr. Silverman?
If it is voluntary, if it is anonymous, and if there is counseling, I encourage individuals to have the test, unless they seem to be psychologically labile and they might jump off the Golden Gate Bridge.
Dr. Pinching?
I can counsel him to avoid risk to himself, avoid risk to others without the test. I don't at the moment see any great advantage in testing him. I've seen too many casualties of inappropriate testing where it hasn't been thought through to be sanguine about testing him if he's going to come to harm from it.
Dr. Farthing, I'm a simple-minded person. I'm not of your profession. I read and I hear a great deal about high blood pressure and what one should do if you have high blood pressure. To me, that's an abstraction. If I don't know that I've got high blood pressure, I find it difficult to believe that I'm going to behave as if I did have high blood pressure. But if I'm told by a medicine man, you have high blood pressure, I might behave quite differently through the knowledge. Or am I being naive about something?
No. You're right. And I feel this is an important difference between having the test and not having it. I think Mr. Server is far more likely to follow those safe sex guidelines if he has the test and it tests positive or negative than if he doesn't have the test.
It may sometimes be true, but I think that by and large, even with someone who is not tested, you can help them to change their lifestyle effectively. And we've certainly been able, I think, to do that with a lot of our patients. So I don't believe that testing is necessary to the process of change.
Well, I'm sure Dr. Green is right when he says that some will modify purely on this advice. But I think the motivation to modify is many times greater if tested positive. And I think this shouldn't be forgotten.
Mr. Grimshaw?
We're actually talking about the perception of risk in two ways. We're talking about whether people see themselves as free of infection and at risk themselves, or we're talking about whether people see themselves as infected and a risk to others. If you have been tested and know that you can pass this virus on to somebody else and they could die as a result, even though you may not actually develop AIDS yourself, then that is a very, very strong motive for changing behavior.
Medical tests, we seem to have grown up thinking that, you know, they're minor little things, your blood pressure, things like that. Yet this one seems to take on heroic proportions.
Yeah, there are tests and tests. I think a lot of people, doctors included, think that all tests are equal and it's just another test. You know, we actually know from experience that if you ask for the Lassa fever test, you can close a hospital in about 10 seconds. I mean, not all tests are equal. And I think the implications with this test are quite different for the individual in front of us than any other test that we've dealt with in recent times.
Dr. Robertson, Samuel Server lives in an area of heavy drug use.
The problem with drug users tends to be slightly different in that they're largely heterosexual, and therefore we get into the heterosexual contact group, and that often makes it often makes the decision slightly
Do you
different.
try and get drug addicts tested?
Well, I think it's important that we're aware of the level of infectivity, and therefore some patients have been tested without their knowledge. When I said I was testing people without consent, I mean, this is a piece of research which is separate from management of patients. I mean, I think research, people would agree, has to be done.
Dr. Tuddenham, hemophiliacs. I gather there's a problem with the factor VIII.
Yes, indeed. The factor VIII is prepared as a concentrate by pooling blood from thousands of donors, and many of those donors were paid by commercial plasma fractionation companies, who are mostly located in the States. And from about 1980 onward, the concentrate contained infective AIDS virus. And many of our patients, perhaps more than half, became infected with AIDS virus.
And when a hemophilia patient came to you or one of your colleagues,
we tested our patients as soon as the test became available. It was information that we badly needed to obtain. We need to know whether the factor concentrates that we're using now, which have been treated in certain ways, are safe.
did they know they were being tested for the virus?
Not necessarily.
Dr. Havard, we have a certain amount of testing going on without consent.
Well, I don't think there should be testing without consent. I think what we've got to remember is the most important thing is for the doctor to get the complete confidence of the patient. And he's not going to get the complete confidence of the patient by just testing him without his permission.
Samuel Server is bisexual. He is indeed married. You have tested him. He is positive. Should his wife, Sarah Server, know?
Yes, I feel she should know, and I would say to Sam that I think he should discuss it with his wife.
Why, Doctor? The marriage is very, very, very shaky at the moment.
Well, it's your decision whether you tell your wife or not, but you must understand that if you are going to have repeated intercourse with her without a sheath, you are exposing her to infection.
What if, in the course of our interview, it has come out that not only am I married, but as we indicated before, I have relations with men? Should they be notified?
Again, it's your decision. I would encourage you to tell your sexual partners, but I would leave it up to you.
In the case of a patient with syphilis, what's the standard operating procedure?
The same initially, to ask the patient to tell their sexual contacts and to bring those sexual contacts in and treat them. The situation with syphilis is a little different. We are dealing with a curable disease, and it's therefore very important that we see the contacts to treat them and cure them.
Now, take the same situation with a homosexual who has just tested positive. Would you do the contact tracing on that individual's partner?
No, we wouldn't, because of the additional problems with the HTLV3 antibody test. There are many of the implications that we've already been discussing. And we couldn't offer the contact when we brought them in a cure.
So the distinction between syphilis is that you can cure it, whereas there's nothing to be done with a positive.
We would lose the confidence entirely of the patients that come to us. We wouldn't have patients coming voluntarily because they'd be frightened. We'd seek out their contacts. Even if it was anonymously, that would often be obvious who it was. And we would therefore see, in effect, less patients and do less good.
Mr. Grimshaw, are these apprehensions real on the part of these doctors in terms of contact tracing?
Very much so, yes. Yes, indeed. As far as contact tracing and who is going to find out that you have this disease, one of the most frightening things for people like myself who have this virus is that we will lose control of who knows.
Sir Gerard?
I find it a bit strange that the doctors will go to such enormous lengths to trace venereal disease contacts, which are treatable, and yet will not go to such enormous lengths to trace AIDS contacts, knowing that this could kill innocent people, ignorant people.
What should be done with Samuel Server's wife, Sarah? You are his doctor.
If at the end of the day he refused to tell her, and I thought she was seriously at risk, I would like to have the support of my medical colleagues and legally to tell her. Because I wouldn't be happy to think that day after day, maybe, she was going around not only ignorant, but in danger of catching something which could be lethal, and is likely to be lethal.
Dr. Pinching seems to be in some distress.
Yes, I am. I think this obviously does get to a very difficult area, but I think when the chips are down, the individual who consults you about HTLV3 infection is the primary patient, and it is to that patient you owe a duty of responsibility.
Sarah's on your list also.
It's an extreme scenario, but I think in that situation, for me, the relationship between the patient and the doctor is a singular relationship of trust, and if you start to break that, you break down the whole structure on which medical confidentiality and medical understanding and treatment are based.
Just let her walk out.
It's painful, but I think we have to do it.
Dr. Robertson?
Can I say I would tell her, and I have in this situation, I have told, after reaching the conclusion with the patient with the disease, the male with the disease, when he refuses absolutely to pass on this information to his spouse or his sexual contact, I've said, if she is in fact a patient of mine and doesn't fall within a recognized risk group or a recognized high risk group and is therefore unaware of the risk she's running, if she was a patient of mine, then I would consider it my duty to let her know. The assumption being that we might prevent somebody getting AIDS rather than have to pick up the pieces later.
He speaks eloquently about that doctor-patient confidentiality.
Well, I think the relationship with the wife is important as well.
Dr. Farthing, she comes in. Here I am. And I think, Doctor, Samuel's behaving a little bit funny. We've had a very vigorous sex life until recently. And suddenly he's wearing condoms. He never did that before. You know, I'm on the pill.
Mrs. Server. Mrs. Server, it's not possible for me to discuss the details of your husband's...
Are you suggesting something's wrong with him?
Mrs. Server, have you asked your husband why he started to wear condoms? There may be that he has something very important to say to you. I think you should discuss it.
You're not trying to tell me something, are you, Doctor?
No,
In that subtle medical way of yours?
I'm sorry, Mrs. Server, but I do have a lot of patients waiting.
Dr. Green, what about you?
I don't think you can hint. Either you're going to tell her or you're not going to tell her. I don't think you are going to tell her for a very good reason, because if you give away patients' confidences, it discourages them from coming to actually see you.
Dr. Howard?
Well, I'm absolutely in agreement with that. It's if the potential sufferer from AIDS knows that the doctor's likely to tell his wife, then he won't come, he won't have the test.
She is in your office, Doctor. And she said, well, I think I'll come off the pill and surprise him. Has that changed anything for you, Dr. Pynchon?
Again, I would have to take it back to Samuel Server. One has to say that in this situation, we're talking about a 50% chance of the child becoming infected and a 50% chance of those infected children developing AIDS, and additionally, a very high risk to the woman if she were to become infected, already be infected.
What is your duty to her at this point?
You would have to find some surrogate for dissuading her, if only as a temporizing maneuver while you persuade Samuel to a more reasonable approach.
You mean telling a third person?
No. A surrogate reason for not coming off the pill.
A lie. It is more blessed to lie than to breach confidence. Just a question, just a question. Dr. Dunbar says yes.
Yeah, I would quite definitely find some reason why she should not become pregnant other than telling her that Samuel is positive. I can think of half a dozen reasons.
You think that is in the long-term best interest of the medical profession, to lie to patients?
In the long-term best interest of her, it doesn't have to be a lie. I can tell her, you know, you're getting on a bit. I'm not sure.
I'm only 28.
28 is late to start having a family.
I'm long in the tooth.
Yeah, I think you might have, you know, cyst on the ovary. Don't you think you should go and see a specialist about, you know, difficulties in having children, and you choose the chap with the longest waiting list and the furthest, you buy some time.
You're also deceiving her.
No.
You're protecting her.
You're protecting her.
The end justifies the means.
Yes, it does.
Dr. Silverman?
Well, I have a real problem. I don't know. I think you can try some of this subterfuges, but I don't think you're really protecting her by lying to her. You're protecting him by lying to her. You're not protecting her.
You can't trust a doctor. They're no damn good. They talk big about confidence, but when the chips are down, they squeal on you every time. Now, we've got two squealers at this table. We've got one liar, two squealers, and an ostrich.
Yes, but a patient can say that anyway. I mean, you hear patients talking about their physicians and...
Speak for your own patients.
But a heterosexual who is married, who thinks her husband is been true to her, is totally ignorant and unaware that she might be being placed at risk. We're talking about something that is not treatable and that, in fact, is lethal, and, in fact, the risk of transfer from male to female is much greater than from female to male. So your female partner is at a greater risk.
Warranting the breach.
Yes.
Let me try one
With a
more
lot of
time,
discussion.
Dr. Green. She comes to you, this patient on your list, and says, isn't it wonderful? I'm pregnant. Is it wonderful?
It's very bad news indeed if she's pregnant.
Mr. Johnson, Sarah Server is furious, apoplectic, puts it mildly, about the failure of her doctor to inform her of this grave risk to her body from her husband. She seeks counsel. What would you say to her?
You can sue your doctor if he was negligent in what he did. He will be negligent only if what he did was not a course that would not have been followed by a body of responsible medical opinion. That's to say, provided that the doctor is doing something that a responsible body of other doctors would have done, the fact that the majority of doctors wouldn't have done it, or the fact that the judge doesn't approve of it, or that I don't approve of it, doesn't matter.
Even though Doctors Robertson and Silverman would have told me.
Absolutely.
Samuel wants you to sue Robertson and Silverman because they told Sarah and she has left him.
I like that one. I can see I'm getting a divorce case out of this as well.
But your senile dementia, not just hospitals, but social services too, will have an increasing problem caring for victims infected but
have been
insufficiently.
Is a waiter. You own it. You've been at it for 40 years. You've built it up through hard work. You're proud of it. And there's this rumor circulating that one of your waiters has AIDS. And some of your old-time customers, like Mr. Gale, not coming in anymore. What are you going to do about that?
I think really that I would expect all the staff to take medical examinations such as they do in most of the multiple stores anyway, and that should include the blood tests.
What if one of your employees refuses to be tested?
Well, there's one thing for sure, if it was Sam, he'd have to go.
Fire him.
Yeah.
Never been a case. We've heard the testimony. Never been a case of transmitting the virus through saliva.
Too risky to me and to the business.
Why, you've got a new
And to my
clientele. Dr. Farthing is coming in daily now.
I'd sooner have George.
Mr. Grimshaw, reaction?
I'm appalled. I'm absolutely appalled. I wonder what the basis of Mr. Judge's fear is.
Mr. Judge, you would fire anyone who's antibody positive?
Yes.
Even if it were a hemophiliac?
You're going into a different field then, but I think, yes, I really do. You've still got the welfare of the other staff to take into account and their feelings.
Is he doing anything illegal, Mr. Johnson?
You are entitled to dismiss him if what you're doing is, putting it in simple terms, reasonable, provided you've acted fairly. I think on the basis of the material we've got so far, a court would think that what you were doing was fanciful and far-fetched. With the medical opinion as firmly as expressed as it is here, you're going to have to pay this man, but commercially it's probably going to be worthwhile to sack him.
Does Mr. Judge have a duty as his contribution to humanity not to start sacking his staff left, right, and centre on mere rumour? Don't we have to carry a lot of these risks within us now? within our society.
He's losing a lot of business.
But he might lose business if he employed a black, a woman, an Italian, a Jew, a Catholic. Does that mean that he can just fire willy-nilly?
Dr. Farthing, here's a man whose entire life is wrapped up into the hungry gourmet. You fault him?
Yes, I'm very disappointed in Mr. Judge. I can understand and sympathize with many restaurant owners operating that way out of ignorance, but he should no longer be ignorant. I'm very disappointed to hear that.
Time moves on. Sarah and Samuel have had a son, Sidney by name. Sidney, sadly, has the virus. He is now of school age. Ms. Khan?
I'm delighted to have him.
You are?
Oh, indeed. I would assume, despite medical confidentiality, that I, as the person in charge of the child, and of course being in loco parentis, as I am as the head of a school, would be told.
That's a big assumption. The information hasn't exactly been out on the Rialto this morning. You wouldn't want to tell her?
I don't think it's necessary to tell her.
I don't think it's necessary to tell her.
Dr. Tuddenham, in taking care of Sidney, assume for the moment he is hemophiliac, do you want to tell Ms. Khan?
I don't want to, and the Health Department directive is that I have to observe the strictest possible confidentiality, and that we do. However, it is also accepted that there are people who have a need to know.
Forgive me, my bluntness from the other side of the Atlantic. I haven't heard you say, Ms. Khan, Sidney Server is antibody positive. Will you do that?
Yes, I would. And I think we have to confront realities and then educate people about the lack of risk of transmission in families. We know that the families of hemophiliacs, through family contacts, are not at risk.
You still want to know?
Oh, indeed I want to know.
Let's assume you find out. Who else are you going to tell?
I would call a meeting, quite seriously, and at the end of the evening, I should hope, the parents will go away feeling assured, the staff will know how to cope, and it'll filter through to the children. There's a child who may have special needs. In other words, you don't go around biting him.
Are we told who it is?
We don't need to.
In other words, we can't bite anybody.
We don't.
You're depriving us of our right to bite.
Oh, absolutely.
Mr. Judge, you have a child in that school, and you've gone to the meeting.
I should withdraw my child from the school.
Why would you take the child out?
Back to where I've been all along, I still think there's a risk, and I wouldn't let my child go to that school.
Dr. Pinching?
The issues that arise are spurious issues. They give Mr. Judge cause for needless concern and anxiety that allow him to make quite inappropriate decisions about his life, his children's life, and everything else. And what we're failing to do is to educate the general public about this as a sexually transmitted disease. In the school, they're going to need to be educated about the real modes of transmission. First of all, we have to get away from the perception that this is a uniquely homosexual disease. So we say, is AIDS a gay disease? The answer is no. AIDS could affect anyone who is sexually active. They've got to know that anal intercourse and vaginal intercourse are a risk, and you then start to talk about safe sex. What are the risks?
Public education.
Absolutely. The
How
more
explicit are you going to be?
As explicit as you need to be. You can't mess about with a sexually transmitted disease of this severity and be
You'll talk about anal intercourse.
Yes, you have to.
You'll have drawing?
Yes. I think you have to be quite explicit.
Mr. Whitehead, do you approve of this?
I approve absolutely. I mean, it is a very serious public health problem. We cannot, because of politics involved or public delicacy or the prevailing morality, it must be laid on the line.
Any difficulty with that, Mr. Gale?
No, I don't think so. But I mean, I think the simple explanation that is required to be put across is that promiscuous homosexual behavior is largely responsible for the spread of this disease, that if you like, buggery kills. And this is the message. As far as I can argue a slight point with Dr. Pynchon, and then he talked about vaginal intercourse. I thought that the weight of medical opinion here was that there was far less risk there than there was with anal intercourse.
This is exactly the problem, that these speculations and inappropriate extrapolations from the evidence have been put about by newspapers such as yours as though they were fact. And while people confuse the issue by talking about buggery and homosexuality, they are, in fact, doing a great disservice to those people who actually can benefit most.
Well, how is it that it is the homosexual community which is so substantially at risk at the moment?
The reason for that is the same reason that
promiscuous behavior.
The reason is that there is a large proportion, a subgroup of that culture that has a larger number of sexual partners than is common among heterosexuals. The same way, I'm not going to use judgmental terms, that's for you. But the issue is that syphilis, for example, is much more common among homosexual males in Europe and North America. You don't call that a gay disease. It's simply that we're talking about the relative risks of transmission, and the more people you meet, the more likely you are to meet it.
Mr. Gale, let me get something straight. Are you quarreling with the nature of Dr. Pynchon's
If he's trying to fudge the issue, which I suspect he is.
I'm certainly not.
Well, in that case, all right, fine, in that case I withdraw.
You have no difficulty on what Mr. Whitehead referred to a delicacy level.
I think there's a slight problem. I'm not at all sure that the kind of advertising that one would devise along these lines would work particularly.
He doubts that people really will modify their behavior based on your explicit, informative advertisements. And I must say, at dinner last night, I saw you smoking a cigar.
Yes.
This after 20 years of public education about smoking.
Yes, I totally take your point that people may not do everything you wish them to do, but it takes two to transmit from an infected to an uninfected. And if you attack both of those individuals with your education program, you have a greater chance of stopping that infection than if you target just the one.
Samuel Server has come on sad time. The marriage broken up. He's been fired from his job. He's been behind on his support payments to Sarah. Recently, he has been convicted of assault with a deadly weapon on one of Sarah's new friends. And he has just been admitted to your prison, Mr. Kay. Will Samuel be tested when he comes in?
Not without his consent.
You don't ask each incoming
indeed,
prisoner?
I don't know. That's a matter for a medical officer. Unless you can actually have a reason to think that the person might be in a risk group, then really you wouldn't pursue the questions any further than are you or are you not?
Dr. Havard, don't you really want to make sure you know whether Samuel Server is antibody positive?
Basically, no, but it would depend upon what Samuel was in for.
Assault with a deadly weapon.
No, I don't think I would want to know.
As long as the deadly weapon wasn't part of his anatomy, it wouldn't bother.
Let us come to the final chapter of Samuel Server. His condition is advanced. Despite all attempts, he is continuing a very, very active pattern of promiscuous behavior.
What is advanced, his infection or his behavior?
Both.
If his infection is advanced, in this country, there are provisions for taking him to hospital for that purpose under compulsory orders.
What would be necessary to put him into hospital? Which I take it is a mild word for quarantine.
It would be done under regulations with the connivance of the environmental health officer.
Connivance?
Well, agreement.
Agreement. Now, what would have to be shown to take him as it were, off the street.
That he was so infectious that he was dangerous to other people. The degree of infection was so great that it couldn't be accepted.
Dr. Silverman, take them off the street.
I think that gives a false sense of security. That tells people that the people who are on the street are safe.
Better to take no one off the street?
Better to educate everyone. The sexually transmitted disease rate amongst gay men in San Francisco has dropped 90%. 90%. That is the most incredible change in behavior I think we have seen in any medical problem. I think if it can happen in the gay community, there's no reason why it can't happen in the straight community.
Thank you.